Fox 5 Health News. Long-term use of a popular drug to treat pain may not increase heart disease risk after all.
Joining us now is Fox 5 medical contributor Dr. Devi. Good to see you today.
Good to see you too.
All right. Well, this is a very, very well-known drug.
Exactly, and people used to think that it had a lot more side effects. They were concerned about the risk of heart attack. So just for perspective, you know, there's a whole class
We're talking
of
about Celebrex.
I was going to say, name it, please. Celebrex, Vioxx. It's okay.
Well, Vioxx still not available, but Celebrex, yes.
Yes.
But it's good you mentioned that because actually, so the anti-inflammatories that we had in the past were naproxen, ibuprofen, things that you find over the counter pretty easily. I mean, there's prescription strength dosing too. But anyway, the newer drugs, Celebrex, Vioxx, these aren't that new, Bextra, these were introduced because they were thought to be safer for your gut. But then there was sort of more research that came out that they are safer in terms of those gastrointestinal side effects, it seems. But maybe because they're more powerful in terms of treating inflammation, they also may cause other side effects. So they might have negative consequences for your heart. So they might increase your heart attack risk. Now, this was confusing at first because, you know, people thought that maybe they'd be like aspirin, that they would be more protective for your heart. So basically, there was this pendulum that went the other direction where people thought these are very unsafe. They took Vioxx and Bextra off the market, and Celebrex was still left around, but it kind of got this negative connotation because people thought it could increase that risk. Now, with this new study, they compared the three. So they compared naproxen, ibuprofen, and Celebrex against each other to look at the benefits and the side effects. Now, they all seem to help with, you know, pain and inflammation, but at the same time, you know, Celebrex didn't seem to be much more harmful than the other two. So it seems to be safe in comparison. People don't have to worry as much. Now, there's a couple things just with this study to keep in mind. So a lot of the patients that were enrolled in the study dropped out, a significant portion. So we don't know what that means. I mean, did they drop out of the study because they were feeling better and they just didn't need any more anti-inflammatories? Right. Or did they drop out because they were having some other side effect that they then didn't want to report to the researchers? So that makes it a little confusing. And then, of course, the doses that were being used for the ibuprofen and the naproxen were high, prescription strength doses, not the over-the-counter doses. So it compared well, you know, the Celebrex compared to those. But there's a couple caveats to just keep in mind.
All right, definitely keep that in mind. This one I'm scratching my head about. The benefits of alcohol have been going back and forth, of course, for years. Well, now there's a big study, and you'll explain this study. It finds that a drink a day may be good for you, at least when it comes to your heart.
So exactly, I had the same reaction as you.
It sounds great, coming towards as we head towards the holidays, but
well, it seems that people who have a drink a day may be doing better in terms of their cholesterol, but we don't know if the alcohol is actually protecting them or if they have other habits and they also happen to drink, right? So that's always the confusing part. Now, this study was of 80,000 people, so it was a large study. It was done in China, and they basically looked at HDL, which is a type of cholesterol, the good cholesterol. So you usually divide your cholesterol into LDL and HDL. LDL is bad. HDL is generally good. Now, normally HDL starts to decline as you get older. It goes down and puts you more at risk for heart attack and other types of problems. Now, there are ways to increase the HDL. There's, of course, medication. But there's natural things like exercise. Exercise tends to make it go up. And there's been this theory that alcohol also can help it go up. So with this study, they found that not necessarily that it caused it to go up, but it slowed that age-related decline.
Gotcha.
So it seemed to help the people. And now with the alcohol, it's sort of at both extremes. If you don't have any alcohol and if you have a lot of alcohol, so if you're a heavy drinker, you drink the harder liquors, then you lose that benefit. But if you're a moderate drinker, so you drink sometimes and you drink maybe a drink a day or, you know, something along those lines, less for women, that maybe that does help you. So from my perspective, it's hard to tell what this means. Is the drink actually helping you, or is it that, you know, most people are sort of social drinkers, right? I mean, majority of people. So if that's the case, then maybe there's something else about your habits that is protecting you, but you just happen to drink also.
You're more likely to be out and about and active. And
exactly. I mean, most people try to do some activity, especially this is in China, so you have a lot of people who are walking a lot, doing a lot of exercise, you know, whatever else, trying to at least be aware of their diet. So it's hard to separate out people's habits. I mean, like with most things, the only way you can really tell is if you have people who don't drink, give some of them alcohol, and then look to see, you know, what happens to their cholesterol. But people won't do that because of all the other dangers of alcohol, of course.
Sounds like it was released at the perfect time to get more people to enjoy the holidays.
Yes, right before
not as bad about yourself with that whole thing. All right, Dr. Devi, we appreciate a good info. And
thank you.
Let's get over to Nick.
It was a beautiful day
today, Nick, and we certainly don't take days like this for granted.